Today we'll be discussing the comprehensive set of benefits offered to postdoctoral scholars within the University of California system. Our agenda for today, we're going to discuss plan eligibility. We're going to spend some time discussing the actual benefits themselves, and then we're going to talk briefly about the enrollment process. Plan eligibility. These are the job codes that make up a postdoc. There are 5 codes that you could be in that make you a postdoc. I won't go through all of these, but you should be in one of these codes to make sure that you're a postdoc eligible for these benefits. If you're not sure what job code you're in, check with your departmental contact and they'll be able to tell you. The job code is basically decided by the funding source, the type of funding you're on, whether it's a fellowship, a research grant, whatever the case might be, that determines what job code you would be in. Family member eligibility. Family member eligibility is the same for postdoctoral scholars as it is for all UC faculty and staff. Domestic partners, as long as the domestic partner is registered with a governmental agency or the domestic partner is unregistered, it meets the University of California definition of a domestic partner. Spouses, biological, adopted, or foster children, stepchildren, grandchildren, step-grandchildren to age 26 for medical plans, or legal wards up to age 18. Now at the bottom, please note that when 2 family members are employed by the University of California, you cannot have duplicate coverage. That's not allowed. So in other words, if a postdoc has a spouse who works for the university and that spouse is eligible under the faculty staff plan, you cannot be enrolled in both the faculty staff plan and the postdoc plan at the same time. You need to choose between one or the other. Benefits overview. These are the suites of benefits that are offered to you through the PSBP program, and they're very comprehensive. You have medical insurance, a choice of an HMO or a PPO with MHN Behavioral Health. You have an HMO or a point of service dental plan. You have a PPO vision plan. You have life and AD&D insurance, short-term disability insurance, voluntary long-term disability insurance, and Bright Horizons Enhanced Family Support. We're going to talk about all of these in some detail. We're going to start with medical insurance. Medical insurance is provided by Health Net, and they utilize Managed Health Network, or MHN, for behavioral health. And so whether you're in the PPO plan or the HMO plan, we always recommend that you contact the toll-free number on the back of your ID card that you'll receive in the mail if you're interested in receiving behavioral health services, because it's much easier to find a provider using MHN than it is to try to do it yourself through the provider finder. The coordinator at MHN will help you through the whole process and help you find a provider. What is an HMO plan? An HMO plan is set up so that there's what's called a primary care physician. And this primary care physician, or PCP, acts as a gatekeeper for all of your care. You would select your primary care physician upon enrollment, but if you don't, one will be assigned to you by the insurance company, Health Net. Just make sure that if you do not select your own primary care physician, that the one that is selected for you by Health Net is convenient for you. Make sure it's in a location that is not too far away or inconvenient in any way. If it is, you could change your primary care physician up to once a month if you like. You just call the toll-free number on your ID card that you receive from Health Net, tell them that you want to switch your primary care physician, and let them know who you want to switch to. And you can also choose a different primary care physician for each family member, so you don't all have to have the same doctor. But the way it works basically is, I'll give you an example. Let's say you're out on the weekend, you're playing soccer, and you think you might have a small fracture in your foot. Your foot hurts, basically. You cannot go straight to an orthopedic surgeon under an HMO plan if that's what you feel you need to do. You need to first go to your primary care physician, and if he or she cannot take care of that issue, they will refer you to a specialist, possibly an orthopedic surgeon, and then you would go see that doctor. If you do not go to your primary care physician first, or we'll talk about a few other things sort of down the road, like emergency room visit or a urgent care center, that sort of thing. And so we'll talk about that down the road. Those are other possibilities. But for the most part, if you don't go to your primary care physician first, then you're going to have to pay for all those services yourself. The insurance will not pay for them. And there is no out-of-network benefit. So you have to stay within the network. And as I mentioned, your primary care physician will guide you through the process. Now, here is the actual, some of the benefits for the HMO plan. These are the most common items used by postdocs. Physician office visit. It has a $10 copay. What that means is that let's say you're not feeling well, you go to your doctor, you make an appointment with your primary care physician, and you go see that doctor. The doctor says, I'm not sure what's going on here. We're going to need to do some blood tests for you. And they draw blood and you're on your way. You pay a $10 copay for that visit. It's a flat $10 for the visit. That's what a copay is. You're going to see in a little bit that there's also a term called coinsurance. Coinsurance is a percentage of the total bill. They sound similar, but they're very different. Under your plan, there's no charge for inpatient hospitalization, there's no charge for outpatient hospitalization, and there's no charge for pregnancy or maternity. Now, for outpatient, what that means is that you are having a procedure done. You might have a knee surgery or something like that, and you go to a facility. It could be the hospital or it could be a freestanding surgery center. You have that procedure done, but you don't spend the night in the hospital. You go home after that procedure's done. That's an outpatient procedure. If it's an inpatient stay, that means you actually spend at least one night in the hospital. Medication for prescription drugs. You have a 3-tiered program. The first tier is a $10 copay for a 30-day supply. And these are usually generic drugs that have been out for quite a while, quite common. And you would pay $10 and get a 30-day supply. The next tier are generally brand name drugs that have been out for a while. And it would be a $20 copay for a 30-day supply. And the third tier, which is called non-formulary, are usually cutting-edge drugs that are new to the market. They're very expensive, and you would pay $35 copay for a 30-day supply. Now, if you have maintenance medication that you take every month, I highly recommend that you go to the website, and at the end of this presentation, we'll have all the information for the different websites and email addresses and that sort of thing. But go to the website and look at the mail order prescription program. There's a couple reasons why you want to enroll in this, or actually 3. 1, it's really easy. 2, it's going to save you money because you'll get a 90-day supply of your medication for 2 copays. So you're going to save a third of the cost. And third, it comes directly to your house. You don't even have to go to a pharmacy to pick it up. It just shows up at your doorstep or in your mailbox. So if you have maintenance medication that you take every month, look in a mail order program for the RX. Emergency room visit. It's a $35 copay and it's waived if you're admitted. And what that means is if you go to the emergency room and they end up admitting you to the hospital and you spend at least one night, then that means it was an inpatient stay rather than an emergency room visit. So there would be no charge. But if you don't spend a night in the emergency room, you would have a $35 copay. Now make sure that it's a true emergency when you go to the emergency room. You're really concerned. You have major bleeding, major broken bones, head trauma, heart problems. That's why you go to the emergency room. You don't go to the emergency room because you woke up and you think you might have the flu. That's where you either go to your primary care physician or use an urgent care center. Now, the emergency room, another reason you don't want to go there if it's not an emergency is because the way it works is they triage everybody that's in the emergency room, and the doctors see the patients that are in the worst physical shape. And so if you're there for you don't feel well, you think you have the flu, you will probably sit there for a good 7-8 hours or longer. while the patients that have heart problems and bleeding and that sort of thing are seen before you. So if it's not a true emergency, then you would go to the urgent care center. And under this plan, again, it's a $35 copay. And the way that works is you go to the urgent care center, you sign in, they go down the list in order of the patients that came in, and you're usually in and out of there within probably a half hour to an hour. It's much quicker than a hospital, much more convenient. You can find the in-network urgent care centers in a provider finder on the website, but I recommend always just call your primary care physician's office and get a couple urgent care centers that are in network that they would recommend and utilize those centers. Routine physical exam, there's no charge. Annual maximum out of pocket, it's $1,500 for an individual and $4,500 for a family. And we're going to talk about this more when I go through the PPO plan because it really pertains to the PPO plan. But what it means is once you've paid $1,500 out of your pocket towards your medical care that's covered under this plan, then the insurance company will pay the rest, not only for that hospital stay, if it was a hospital stay, but for the rest of the year, for all covered expenses for the rest of the year. It's a safety net for you. But when you look at this program, the HMO program, because the copays are so low, it's very unlikely you're going to spend $1,500 out of pocket in a calendar year. But you're going to see on the PPO plan, it's very easy to do that, and this does come into play. We'll talk about it more then. Under this plan, there's no deductible, and there is no lifetime maximum, which means as long as you're receiving care that is covered by this program, the insurance company is going to continue to pay for that care. As I mentioned before, everything needs to be directed by your primary care physician outside of urgent care and emergency room visits. So there is no out-of-network benefit. HMO behavioral health. If you need outpatient therapy for behavioral health, there's no referral needed and there's a $10 copay. But remember, you need to see an in-network doctor. That's when you would call MHN to find a doctor. Higher levels of care that you see listed here, you do need a referral, but there's no copay. And other services that you see listed here, intensive outpatient, partial hospitalization, and the others, you do need a referral and there's no copay. It's really important you understand that referral aspect because if you don't get a referral first, you're going to likely be paying for the entire cost of those visits. The postdoc monthly contributions for the HMO plan. This is the amount that's going to come out of your paycheck each month to cover the cost of your benefits on your behalf. Postdoc only will pay $12.71. Postdoc plus spouse or domestic partner, $45.77. Postdoc plus children, $22.25. And family, $58.16. And that includes all the lines of coverage that we talked about before, the medical, dental, vision, life, disability. All of those programs will be covered under this one monthly contribution. Let's talk about the PPO plan. What is a PPO plan? PPO plan is a plan where, unlike the HMO plan, you don't need to see a primary care physician first. You don't have a primary care physician assigned to you. You could go to the network, find the doctor you want to see, and make an appointment to see that doctor. If you want to go out of network, you can do that as well. It's likely going to cost you more when you go out of network, but you have the ability to do that. So that same example I told you, you're out on Saturday playing soccer and you think you hurt your foot and need to see an orthopedic surgeon. You could go to the provider finder, look up an orthopedic surgeon that's in network and make an appointment. That's how the PPO works. If you have another orthopedic surgeon that's not in network and you really want to see that doctor, you can still do that. It's just going to cost you more. And the reason that it usually costs more out of network is because in network, doctors and dentists both, and on the vision plan, they've already agreed to provide their services for the insurance company and for you at a discounted rate. And when a lot of this is co-insurance, remember that's a percentage of the total bill, you want to be paying a percentage of a bill that's already negotiated lower. So try to stay in network if at all possible. Here is the PPO plan, the major benefits that you're going to be using. An office visit, $20 copay if you stay in network. If you go out of network, it's 40%. So try to stay in network, because remember, 40% is 40% of the total cost of that visit. And I can almost guarantee you that an office visit is going to be 40% of an office visit is going to be more than $20. So try to stay in network. Hospitalization, in network, $250 copay, then 20%. Out of network, $250 copay, then 40%. You'll see they're continually trying to keep you and encourage you to stay in network because it saves the insurance company money and it saves you money. But what that means is, let's say you need to go to the hospital and you're going to spend a few nights there. You would pay the first $250 of the stay, and then you would pay 20% coinsurance. So 20% of the remaining bill. Now, this is where I'm going to jump down real quick to the annual out-of-pocket maximum that I mentioned in the HMO side. As I said before, it is a safety net because hospital stays are extremely expensive. They could be up to $1 million pretty easily. And so what this does is, you probably can't afford, I know I can't, to pay $250 than 20% of $1 million bill. The out-of-pocket maximum, what that says is, once you've paid $1,500 toward the cost of your care during the year, then all the rest of the year, that calendar year, covered benefits will be paid at 100% by the insurance company. So even in the scenario I just told you, you're in the hospital, it's $1 million bill, you'll pay $1,500. And not only that for that hospital stay, but that's for the rest of the year. If other things come up during the year, the insurance company will pay 100% of the bill. It's very important you understand how that works. Now it says 4,500 family. What that means is it's a second safety net. Each member of your family has an individual $1,500 maximum. But let's say that you have a big family, you've got 6 people in your family. Once the family combined during the year has paid $4,500 in medical expenses out of pocket, then the whole family is covered at 100% for the rest of the year. So it's a second safety net if you have a large family. I won't go through the prescriptions again because that's the same as it was with the HMO plan. Emergency room visit. Under the PPO plan, it's 20% coinsurance. And emergency rooms are extremely expensive. So 20% of an extremely expensive bill can add up fast. So if it's not a true emergency, go to the urgent care center, which as you see is also 20%, but it's going to be 20% of a much smaller bill when you receive the services. Routine physical exam, there's no charge. Deductible, there's no deductible if you stay in network. $200 deductible out of network. And what that means is if you do go out of network, the first time you receive care during the year, you're going to pay the first $200 toward that care. And then whatever the coinsurance or co-payments, whatever the case might be, then the insurance will start paying their share. But you pay the first total $200 of cost at the beginning of the year. And you only do that once. It's an annual deductible. But if you stay in network, there is no deductible. So try to do that. Lifetime maximum is unlimited. So as long as you are receiving care that's covered under the plan, the insurance company will continue to pay for it. The behavioral health under the PPO plan, there is no referral needed for outpatient therapy. If you're an in-network, there's no cost. If you're out of network, there's no cost. If the provider is charging the amount that is equal to or less than the maximum allowable amount. And this is really important for you to understand. In-network doctors, remember, have signed a contract with the insurance company to provide their services at a predetermined rate. So you're definitely going to pay $0 in network. Out of network, the doctors have not agreed to anything. They can charge whatever they want, but the insurance company has a maximum allowable amount, and that's the maximum they're going to pay to that provider. So if that provider is charging more than what is the insurance company will pay, you need to know that ahead of time, because you will be responsible for that amount over the maximum allowable amount. Higher levels of care, inpatient psychiatric residential treatment, a referral is needed, and there is no cost in network or out of network as long as it doesn't exceed the maximum allowable amount. Additional types of behavioral health coverage, higher levels, there is no referral needed, 20% coinsurance in network, 20% out of network. And you'll see the other psychological and neuropsychological testing, applied behavioral analysis, and some other items. There is no referral needed, no cost in network or out of network, again, as long as it does not exceed the maximum allowable amount. The monthly contributions, the amount coming out of your paycheck each month for the PPO plan, the postdoc only would be $20. Postdoc plus spouse or domestic partner would be $40. Postdoc plus children would be $40. Postdoc plus spouse and children, in other words, a family, would be $60. And that's for medical, dental, vision, life, short-term disability, and Bright Horizons Care Advantage. So very good suite of benefits, and this is the amount you would pay out of your paycheck for that. Wellness programs. There are a number of wellness programs available to postdocs through the medical plans. I'm not going to go through all of them because there are so many. I just have put a few up here so you can see what's available. But there are all kinds of things. Smoking cessation programs, maternity-related programs, weight loss programs, discounts on gym memberships, discounts on vitamins, all kinds of wellness programs out there available to you. So when you have a few minutes, go to the website and check out the wellness section and see if there's something that interests you there. Now we're going to talk about dental insurance. You have two plans available to you under the dental insurance, a DHMO plan and a point of service plan. The DHMO plan works very similar to the medical HMO plan in that you have a primary care dentist that you need to go see for all of your care. If that dentist can't take care of you, they will refer you to a specialist who can. But you have to start with your primary care dentist. And like with the medical HMO, you could change that dentist up to once a month if you want to, until you find one that you like. Under the HMO plan, there is no calendar year deductible. And the routine care, the routine exams, teeth cleanings, x-rays, there's no charge. They really want to get you in there for these, the checkups, so that it doesn't turn into something that's very expensive for both you and the insurance company, like a crown or a root canal or something like that. So get in there for your exam. Now, one thing I want to point out is make sure, you should do this with all lines of coverage, but make sure with dental, because it can be confusing with dental. Make sure you get in writing what the cost is going to be to you out of pocket. Don't just make assumptions. And a good example is quite often under the DHMO dental plan, a dentist will ask the postdoc, after they've done their exam and cleaning and x-rays, they'll say, it seems like you need a cleaning. And the postdoc said, and they asked, do you want me to do that? Postdoc says, sure. And the postdoc kind of thinking, I thought I got a cleaning. What the doctor is saying is a deep cleaning. A deep cleaning is very different than a routine cleaning. It's much more expensive. So make sure that if they ask you something, they ask for permission to do something, that you find out, and preferably in writing, what that cost is going to be to you. Now, the next items are things that are most commonly used by postdocs. And it says varies up to, because the DHMO dental plan goes by a set of codes called ADA codes, American Dental Association codes. And there's literally hundreds of them. And each code has a different copay associated with it. We don't have time to go through all of those, and I don't think you want to go through all those. So we said varies up to. So an example, under fillings, you could have a 1 surface filling, a 2 surface filling, a 3 surface filling. They all have different ADA codes and different copays associated with them. That's why we list it as varies up to on this example. Endodontics varies up to $175 copay. Non-surgical periodontics up to $200 copay, and simple oral surgery up to a $300 copay. Crowns, this is a great benefit. Crowns are very expensive. Even with good dental insurance, they could be $600, $700, $800 out of pocket. Your plan has a maximum copay of $200. Very rich benefit. But make sure that you understand that this is a basic crown. This is not, if your dentist comes to you and says, I think gold is the best, it's more durable, you should get a gold crown. Ask them what it's going to cost, because that's not a basic crown and it's going to be more than $200. So make sure you find that out before they install that gold crown, because once that dentist has installed that gold crown, it's too late to argue about it. Orthodontia, it's available for children and adults. And you see the copays here. The annual maximum is unlimited, so there is no limit. So as long as you're receiving care for covered benefits, the insurance company, which is HealthNet, is going to continue to pay for that care. What is a dental point of service plan? Point of service plan is very similar to the PPO medical plan in that you don't have a primary care dentist. The difference is you have two networks to choose from rather than just one in-network option. You have an exclusive provider organization or an EPO, and those dentists have already agreed with the insurance company, which is called the principal, to discounts up to 50% versus you just walking in off the street. So if at all possible, try to use the EPO dentist. The PPO dentists have agreed to discounts up to 30% versus just walking in off the street, which is also a very good offering. Because remember, you're going to be paying co-insurance on almost everything, so you're paying a percentage of the total bill. So you want to be paying a percentage of a bill that's already been negotiated down with the insurance company. If you go out of network, those dentists can charge whatever they want. We'll talk about that more in a minute, but they have not agreed to discounts already. Now, as with the PPO medical, the insurance company is trying to encourage you to stay in network if possible. You'll see if you go in network, it's $1,700 per year. If you go out of network, it's $1,500. And that is the maximum. This is the opposite of the out-of-pocket maximum, which was a safety net under the medical plan. This means the opposite. Once the insurance company has paid this amount towards your care, so if you go in network, the insurance company in that calendar year pays $1,700 towards your care, you're on your own to pay 100% of the cost for the rest of the year until the next January 1st. So make sure you understand that. Here are the most common benefits under the point of service plan. There is, if you stay in network, there's no deductible. If you go out of network, it's a $50 per person deductible. So try to stay in network. Routine exams, cleanings, x-rays, no charge. So get in there and get that work done. Basic procedures, 10%, 10% coinsurance if you stay in network. So you're going to be paying 10% of the cost of that visit. Majors, you're going to see not only are they trying to incentivize you to stay in network, but they're trying to incentivize you to go to the EPO network, which will save you money and save the insurance company money. So if you go in for a crown, let's say, you're going to, and it's an EPO dentist, you would pay 40% and the insurance company would pay 60%. If you go to a PPO dentist, you would split it 50-50. Now, if you look to the right on the out of network, it says 50% of the scheduled allowance. Now, that seems like it would be the same as if you went to the PPO plan, but it's not. Because the PPO plan, remember, they've already agreed to charge a discounted rate with the insurance company. So that insurance company knows what that dentist is going to charge. If you go out of network, the dentist can charge whatever they want, but it doesn't mean that the insurance company is going to pay that amount. So an example, you go to a dentist and that dentist is out of network and says, you need a crown. And the dentist says it's going to cost $1,000. Well, the insurance company has a database they use. They look at their database and say, well, we think reasonable and customary in that area for a crown is $800. Well, you would have to pay that whole $200 over what the insurance company has as a scheduled allowance, and then you'd split the remaining 800 50-50. So make sure that, especially if you go out of network, you get in writing what your out-of-pocket cost is going to be from that dentist. Orthodontia, adult and children, it's 50% benefit. And annual maximum, as I mentioned before, 1,700 in network, 1,500 out of network per calendar year. Vision insurance. You have a PPO vision plan, and it's a huge network, so you have no reason not to stay in network. You can go out of network, but it's going to cost you a lot more if you go out of network. So keep that in mind. Good example, and I'm going to focus mainly on this presentation with you going in network because it's going to save you so much money, and you really should go in network if possible. An exam with dilation, there's no charge if you go in network. If you go out of network, the insurance company is going to pay up to $40. And I can guarantee you that that office visit with that exam with dilation is going to be a lot more than $40. And you're going to have to pay for that. Try to stay in network. The lenses, standard lenses, you see them all listed there, $10 copay. Frames, there's no copay and $120 retail allowance, plus 20% off any balance over that allowance. And what that means is if you need new frames, there's no copay. And as long as you choose a pair of frames that's $120 or less, you won't pay anything for the frames. If you like the designer frames, you want to get Gucci or something like that, and they're really expensive, you could do that. The insurance company is going to pay $120 toward those frames, and then they'll give you a 20% discount off the balance that you would pay. You see the different copays for the upgrades to the lenses, $15 or $45. Contact lenses, there's a $105 allowance toward contacts plus 15% off if you need more than that. So if you're getting contacts and it's going to be more than $105 for the year, then you would get a 15% discount off that remaining amount. Now, this is what we call a 12-12-24 plan, which means you get an exam every 12 months, lenses or contacts every 12 months, not both, and frames every 24 months. Now, keep in mind, unlike the other plans we just discussed, these are actual months. This is not based on a calendar year like the other plans. If you were to receive or you went in for an exam on February 1st, you would be eligible the next February 1st for an exam. It doesn't reset like the other plans on January 1st. Health and dependent care flexible spending accounts. Flexible spending accounts are now offered to postdocs effective January 1st, 2023. A flexible spending account is an employee benefit that allows you to have pre-tax dollars withheld from your paycheck to pay for eligible healthcare or dependent care expenses. It covers not just your medical expenses, but also the expenses of your spouse and tax dependents. Depending on your tax bracket, you could save up to 30% in taxes. The healthcare FSA can cover medical, dental, or vision expenses that you would otherwise pay for out of pocket. With an F, you use pre-tax dollars to pay for qualified out-of-pocket healthcare expenses. Common qualified expenses that a healthcare FSA will usually cover include the deductible, coinsurance or copayment amounts for your health plan, eyeglasses or contact lenses, dental work and orthodontia, medical equipment, hearing aids, and chiropractic care. Many over-the-counter drugs such as cold and allergy medicines, pain relievers, and antacids can also be reimbursed through an FSA. Your healthcare FSA funds are available on day one, which means that all of your FSA funds are available to spend right away. For example, if you elect to contribute $1,200 to your FSA, your contributions will be deducted evenly across all your paychecks for the year, but you'll have access to the $1,200 on day one. You can use your funds for expenses incurred by you, your spouse, or eligible dependents. Think of it like a discount on healthcare expenses at stores such as Amazon, Target, CVS, Walmart, Walgreens, and more. Dollars you contribute are taken out of your paycheck before tax, which means a $100 purchase would actually cost you over $118 without a medical FSA. If you can also visit FSAstore.com to shop for eligible FSA items without wondering if they're reimbursable. Based on what you think your healthcare expense will be for the rest of the year, you can plan ahead and set those funds aside in a health FSA. You won't pay taxes on any of the funds you spend through the account, which can add up to significant savings over the course of the year. Know that the health FSA cannot be used to pay for health insurance, life insurance, or any other insurance premiums. The dependent care FSA. Your dependent care FSA can be used to pay for out-of-pocket daycare expenses, after-school programs, and day camp programs for dependents up to age 13. It also covers costs for disabled spouse or dependents of any age. Your household can elect up to $5,000 annually through the dependent care FSA. A household can be a single adult electing $5,000, or if you are married or have a domestic partner, and elect $5,000 total together as a household. If you are married but filing separately, your total annual election can still not exceed the maximum and will be able to elect $2,500 per person. If you earned over $135,000 in 2022, your maximum election would be $3,000. Your plan year runs from January 1st to December 31st, 2023 for both the Health FSA and Dependent Care FSA. Your deadline to incur claims for the Health FSA is December 31st, 2023, while members have until March 15th, 2024 grace period to incur claims for the Dependent Care FSA, as long as your account status is active as of 12/31/23. Claims incurred during the grace period can be reimbursed with the 2023 unused balance. April 15th, 2024 is your runout date for both plans, which means you have until this time to submit all paperwork for claims incurred during the 2023 plan year. You can also submit claims by using the WEX mobile app. Simply log in, select File a Claim, and use the easy-to-follow steps. You can even take a picture of your explanation of benefits or itemized receipt right from your mobile phone. And of course, you can submit a claim through your online account by following similar steps and uploading your documentation or submitting the out-of-pocket reimbursement request form. All claims are processed within 2 business days. You can choose to be reimbursed through direct deposit right to your bank account or have a check mailed to you. Direct deposit is provided free of charge and is a quick and easy way to get your reimbursement. And remember to always keep your receipts, even if you're using the WEX debit card on your expenses. This way you have them available if WEX needs additional information to substantiate your claim. The healthcare FSA allows for the carryover option. A carryover option allows you to transfer up to $610 of your remaining balance at the end of the plan year into the following year. Think of it like safety net for your FSA. If you end up spending less than you anticipate when making your elections during open enrollment, you could tap into those funds next year. Carryover funds become available to you the first week of January of 2024. You are able to carry over up to $610 while still electing the full maximum annual election in the new plan year. If you have the benefits debit card, it will continue to work as normal using your carryover funds first. Any balance in excess of $610 carryover maximum are forfeited. If you leave the university in mid-year or your plan is terminated before December 31st, you will not be eligible for carryover. The FSA carryover is only available for health FSA funds and not for the dependent care account. Your enrollment in an FSA includes a free benefits debit card. This allows you to easily access your FSA funds right from your wallet to help you minimize the amount of out-of-pocket spending. All new cards will be good for 4 years. Regardless if you're enrolled in a healthcare FSA or a dependent care FSA, you will use the same card. If your card is lost or stolen, you can order a new card free of charge from the Benefits mobile app or by going through your online account. You can request a WEX debit card for your dependents and or spouse. First, ensure they are added to your online account. Once they are added, you can select Banking/Cards and request a card for each dependent. A dependent must be 18 years of age or older to receive a debit card. The WEX debit card is the most common way claims are paid against your FSA. The FSA plans are available to postdoc employees in job codes 3252, 3255, and 3256. Postdocs must receive compensation from UC Path payroll to be eligible for the FSA plans. Earnings from grants, scholarships, or direct pay status are not eligible for FSA deductions. Postdoctoral Scholar Fellows, job code 3253, and Postdoctoral Scholar Pay Directs, job code 3254, are ineligible for the postdoc FSA plans. Postdocs can enroll when newly eligible, during open enrollment, or a qualifying life event. Election amounts can also be modified during certain life events. The summary plan description, SPD, located on our website lists the various life events and the types of changes you're permitted to make to your FSA plans. Like your other health plans, changes must be made within 31 days of that qualifying life event. It's important to note, if you change from a job code that is eligible for FSA to a job code that is ineligible, your FSA payroll contribution will be canceled. If you become eligible again within the same plan year, your prior FSA election amount will either be reinstated by your re-enrollment during your PI or by UC Path. Life and AD&D insurance. All postdocs eligible postdocs are enrolled in the Life and AD&D program automatically. You do not need to enroll in this. And what this is should you pass away, should you die, your beneficiary will be awarded $50,000. And if you pass away due to an accident, it would be an additional $50,000. And the only other thing I'll say about this is that make sure you've chosen a beneficiary. If you haven't, go to the UC Path system and choose a beneficiary. It's super easy. All you're doing is filling out a form that says who you want the money to go to and how to contact them. And it could be multiple people if you want. Because if you do have a beneficiary listed, they will be paid very quickly. If you don't, it will probably go to the probate court and will take a long time. And the person you wanted to get the funds may or may not get them. So make sure you go in and fill out a beneficiary form if you haven't done so already. Short-term disability. Short-term disability is a great program. It's income replacement when you're disabled and not able to work. And the plan will pay 70% of your earnings. And your doctor is the one who determines when you are disabled and when you're able to go back to work. And there is a waiting period for 7 days. If it's sickness or pregnancy, there's no waiting if it's an accident. The maximum benefit period for this program is 180 days. So you could be disabled as long as your doctor says you're disabled for up to 180 days and receive 70% of your earnings during that time. And as I mentioned before, all eligible postdocs are automatically enrolled in this program. Now, I do want to point out that on our website and your union that represents you, the United Auto Workers, they developed a very nice document that explains not only the short-term disability time off, but other types of paid time off by the university. Make sure you understand how all those work together. Go to the website and look at that document, because the short-term disability, a good example is a postdoc is going to have a baby and wants to take as much time off as possible while being paid. Well, a lot of the paid time off that the university offers can be taken at any time. But the short-term disability, they generally, for a maternity claim, will allow a 6-week disability claim automatically, and the doctor indicates when that 6 weeks starts. And so if you want to maximize your time off, you would want to take that short-term disability first, because it starts the first day that you're disabled. You can't say, I want to take my 6 weeks, 4 weeks into my time off. So if you want to maximize the time that you're going to take off, take the short-term disability first. But just check out that document so you understand what's available to you. Repatriation and medical evacuation. All postdocs are eligible for this program. And the reason we point it out here is because a lot of postdocs are on J1 visas and their dependents are on J2 visas. And the United States Department of State requires that folks on J visas have a certain amount of repatriation and medical evacuation coverage. And this is not a normal part of a medical plan. So we've added this to your short-term disability. And since you're all enrolled automatically in that, you will be covered for the repatriation and medical evacuation. But as I said, all postdocs have access to this. It's just required of the J visa holders. But what it means is, let's say you're in Mexico and you're on vacation and you're feeling adventurous and you do one of those 100-foot cliff dives, and that cliff dive doesn't go well, and you need to be evacuated to a trauma center. That's medical evacuation. That's what this program pays for. Let's say that dive goes horribly wrong and you don't make it, you pass away. Repatriation is repatriating your body back to your home country, and that's what this program pays for. And so a lot of campuses that don't have this attached to their short-term disability, the postdocs have to get a separate plan to cover this. You don't need to do that. You're covered for the required repat and evac. Voluntary long-term disability insurance. This is voluntary. It's the only program that you pay 100% of the cost of, and that cost is $8.55 per month. And what this program does, it's similar to the short-term disability. It's income replacement should you become disabled. So this program pays 60% of your earnings while you're disabled, and it picks up where the short-term disability leaves off. So after 180 days of short-term disability, if you're still disabled and are unable to work, this program will pay 60% of your earnings until you're age 65 or you're able to go back to work. But keep in mind that I point this out because there are so many international postdocs. I think over 60% of the postdocs at the university are international. If you are disabled and you are a part of the long-term disability program, if you go home, this program will only continue to pay your 60% for 1 year after you leave the United States. So you need to keep that in mind. Bright Horizons Enhanced Family Support. This is a great program paid for by the university. You have to pay for the services that you receive, but this is a great program to help you find a lot of family-related stuff. So it'll help you find childcare solutions, academic support and tutoring, enrichment programs, summer camps, that sort of thing. A lot of times, probably the most often used service for postdocs is childcare. It's Thursday night, and both spouses realize that they're not going to be home the next day, and they need a babysitter. You can go to Bright Horizons website and find a babysitter that's already been vetted, a high-quality babysitter. It's been vetted by Bright Horizons. They've got a great filter. I haven't used it myself, but I heard that you could go in there and say, I'm a postdoc from UC Santa Barbara. I want to find a babysitter that speaks a certain language and is an undergrad at UC Santa Barbara. And if that person exists in their system, they'll give you the contact information, and you can contact them and make arrangements for babysitting. You have to pay for their services, but this program will help get you in touch with them. Great program. The enrollment process. The enrollment process is through what we call UC Path. That's the payroll and benefit system. And there's the link to it right there. If you're a new hire, you have what we call a PIE, a period of initial eligibility. And that starts on day one of your eligibility, and you have 31 days from that day to enroll in the program. So make sure you do it within 31 days. You log into the UC Path with your UC AD username and password. You will be required to go through dual authentication. From the menu, click on Employee Actions, then click on Health and Welfare, click on Enroll in Benefits, and then click on the Open button to begin your electronic enrollment. The Forms Library in the main menu also provides access to manual forms for related enrollment events. And if you need assistance, contact the UC Path Center to get assistance. You don't want to make any assumptions. You want to make sure that you're enrolling in the benefits that you want to be enrolled in. Life events. If you make changes to your eligible family members because of a marriage, divorce, birth, adoption, etc., again, you will have 31 days from the time of that event to enroll yourself and your family members, or remove them if applicable. Now, those life events, and I'm going to point this out because a lot of postdocs are at that age where they're starting families or continuing families. And one of our biggest issues we work with postdocs on is that, they have a baby, happy, healthy baby, and the parents are excited, but they forget to add the baby to the plan. And it's beyond 31 days. You're beyond the eligibility period. So make sure you designate one of the parents as the one who is going to add that baby within the 31 days of birth to the program so you don't run into that situation. You would log into the UC Path with your UC-AD username and password. Again, you would be required to use the dual authentication. You click on Employee Actions, Health and Welfare, Life Events, and follow the directions. And again, contact UC Path if you have any questions. Retirement plans administered by Fidelity. All UC employees paid through the UC system are required to participate in some type of retirement plan. UC employees who are not otherwise covered by a retirement system contribute to the DC plan in lieu of paying Social Security taxes. Postdoc employees in job code 3252, 3255, and 3256 are paid through the UC payroll system and therefore automatically enrolled in the Safe Harbor DCP. Safe Harbor participants automatically contribute on a pre-tax basis 7.5% of their wages beginning the first day of an eligible appointment and for as long as you are employed by UC. Your contribution to your DC plan account are automatically invested in the UC Pathway Fund, but you may direct contributions to any funds offered in the fund menu or other investment options. When you separate from UC, you can leave your DCP funds in your Fidelity account, roll it over to another retirement fund, or pull the money out and pay the taxes on those funds. There are exceptions. Members with J1 or F1 visas who are classified as non-resident aliens for tax purposes are exempt from FICA taxes, OASDI, and Medicare taxes only. Will not participate in the DCP Safe Harbor until they become resident aliens, and participation in the DCP plan will begin. Most people are familiar with the voluntary savings plans. If you worked in the private sector, this plan would have likely been referred to as a 401k. For these types of plans, you put money into them pre-tax, and when you get ready to retire, you have the amount you contributed plus whatever interest/investment return was accumulated over the years. In many cases, your employer may have also contributed to this plan for you. You have the option to save pre-tax dollars by enrolling in the 403B and or the 457B plans. The 403B and 457B are voluntary and you can enroll at any time. It's typically better to start early with even a small contribution than later given the compounding interest. UC does not match or contribute to the voluntary savings plans. The IRS sets a limit on the amount you can contribute. For 2023, you can contribute up to $22,500 if you're under the age of 50, or up to $30,000 if you are age 50 or over. You can contribute to one or both plans. 403B has a loan option, and with the 457B, you will not get a tax penalty when you are allowed to withdraw the money. Fidelity is the plan administrator and provides as many tools and options to support your retirement goals, savings goals. Things to remember on a DCP plan. Enroll in the 403B and 457B at any time. Initial enrollment and changes are subject to payroll deadlines. Establish your beneficiaries. Fidelity retirement option 403B and 457B and DCP. So make sure you choose a beneficiary for this in addition to your life insurance. Here's our contact information. And I cannot stress enough that if you have any questions or concerns, you contact us. That's what we're here for. It could literally save you thousands of dollars out of pocket if you make an assumption. So let's say a good example. You're gonna every time you go to the hospital or a doctor's visit, you're gonna get something called an EOB in the mail, explanation of benefits. And it's gonna list what that doctor or hospital charged the insurance company, what the insurance company paid, and what the amount you are required to pay is. If the amount you're required to pay is listed as something much higher than you expected, contact our office and we'll look into it for you. The insurance companies, they process millions of these claims every year and they make mistakes. And so don't just assume that you misunderstood what your cost was going to be. Contact us and let us verify it. And the website I've been referring to, this entire presentation is listed right here. The toll-free number is listed here. And if you want to send an email, sometimes it's easier working late at night, or you just want it in writing, you could send it to us and we will get right back to you. Questions regarding retirement benefits should be directed to Fidelity, as we don't administer those. Thank you for joining us today, and I hope you have a very productive and enjoyable postdoctoral stay at the university. Thank you.